So I'm about to have a very engaging and interesting conversation with Denise here. It's going to be about interoperability and FHIR. But before you turn off this video already, we're not going to mention those words that much because I'm working in that space, Denise is working in that space. But we also realized it's important to start telling what it actually can do, why it's important, how it matters to real persons. And we think that we can bring that story way better by talking from a perspective of real persons instead of talking about complicated tech words. And Denise happens to be a person that can do it very well because she's professionally very engaged, but has a very rich patient story as well and is very open to share it with us. So I'm super excited to have you here for our chat. But I've given away a little bit of your introduction, but maybe you can introduce yourself first before we dig in.
Sure. So I'm Denise St. Clair. I'm Vice President of Health Policy and Interoperability at a digital tech company called Global Alliant. We do a lot of federal and state contracting work, and I lead all of our work on interoperability and bringing the FHIR standards to production. But I'm in this space because I'm a patient first.
Yeah. And can you maybe, before we dig into the patient space, without using the word interoperability, try to explain what you do in your daily job?
My job is about making sure that we get the right data in the right place at the right time to make patient care better. Because without the right data, doctors can't make the right choices. You can't get the right treatment. You can't ensure you have the right medications. It's all about the right information, right place, right time. That is my goal in life.
That sounds like a very beautiful goal and a very important goal. So, and as you said, you got here because you're a patient and you have a story, and we have been chatting about this more often, so I know parts of it. Can you maybe go back to when it all began?
So I was always that sickly kid, but when I was on the plane home from my honeymoon in 1998, I started to not feel well. I started to have like major vertigo and really bad headaches. And I thought maybe I just gone scuba diving. That was it. But it got worse and it got worse. And 8 years later, I'm in a wheelchair and I've lost all use of my legs and I can barely hold my head up. And I've had a migraine for 8 straight years. I've been spinning with vertigo for 8 straight years. And the doctors could not find what was going on.
So when you were in that airplane, happily coming back from your honeymoon, I guess, did you already feel like something is really wrong, or did you dismiss it like probably a lot of people will?
Yeah, I mean, at first it was like, oh, I just went scuba diving, like maybe it's a little something with the air travel, everything we'll see. And then a couple weeks later, you're like, this isn't getting better. And then a couple weeks after that, it's getting worse. And you start going to see doctors for the first symptoms, right? Because that's what we do. We have segmented healthcare. I go by symptoms. So I have migraines. I have vertigo. What do? I go to a neurologist. Can't find anything. Okay, well, maybe it'll just subside on its own. And then you start having the next symptom. And, so I had every single organ system was ultimately affected. And the doctors just kept saying, we can't find anything. We can't see anything. And then what do you start to hear, especially as a woman with a inexplicable set of symptoms? It got to the point where they were willing to say I had the most unbelievable case of conversion disorder, which is generally lasts a couple weeks or a month or something. Now we're at years. And it was psychological. And it was a hysterical woman looking for attention. And I had the number one neurologist, I was in Wisconsin at the time, say, we are not treating you unless you get a psychological evaluation because we do not think it's neurological. We don't think anything is really wrong. So I said, fine. And I went to a psychologist and he said, you're really together for having been this sick and in this much pain for this long. But you look like you have Parkinson's. Can you guys get in the room? And at that point, I was just beyond frustrated. I knew I was dying. I felt it. I knew something was really, really, really wrong. So being very stubborn, I decided we'd go to a specialist for every single symptom I had. And
I'm going to interrupt you because
sure.
I have so much trouble really understanding or thinking that this actually happened. So you are so sick and all the individual specialists told you there was nothing wrong. Do I hear that correct?
Yeah. I mean, they couldn't find it. They couldn't
couldn't
see it on the
find it.
scan.
But they couldn't
find it.
see it as well, that you
Well,
were, or they just couldn't explain what was
They
happening.
couldn't explain what was happening. And so then it's, well, maybe you're just being dramatic. Maybe you really don't, you just aren't trying hard enough to walk. Maybe it's not as bad as you think.
They told you were not trying hard enough to walk, so you were ending up in a wheelchair and still thinking there was nothing wrong.
Yeah. Yeah.
Incredible.
Or it was psychological. Yeah. It was psychological was the number one thing. I was in my doctor's office and started having a seizure. They rushed me to the hospital to be evaluated because my primary care doctor's watching me seize. They rushed me to the hospital. They run scans. They're not seeing anything on the scans. And as I'm sort of coming out of it, I hear the doctor asking my husband, does she maybe have an eating disorder? And my husband was remarkably patient at that moment. It's like, she's seizing. And after we found out what was wrong, we realized why it wasn't showing up on the scans. But the fact that they would go to psychological, eating disorder, everything but there's something very physically wrong was really, really, really frustrating.
Yeah, because we are now mentioning the word, but it's all about data and the right data at the right time. Did the doctors have enough data? And they were probably not willing to not find anything, so they did their best, but they couldn't find anything.
And I saw a lot of really amazing doctors who felt really bad about the fact that they couldn't find it out. I also found some not so wonderful doctors. But the doctors that were really trying, the problem was I had a paper chart that was this, I'm not kidding you, it was this thick. But how did I even get that thick paper chart? I had to go to every single one of the doctors I was seeing, in every single one of the practices and organizations they were in. I had to go through unbelievable hell to get my records, wet signatures, all kinds of requests. I had to compile my record to get it. Now, they had electronic health record systems that didn't talk to each other. So even if each of my doctors was typing in the information and had their information, they didn't have the other specialists and the other doctor's information. So no one was seeing the complete picture of me.
And you were collecting it yourself.
And I was collecting, because I'm a researcher. I'm getting my PhD at this point. I'm good with data. And I was determined to help show the story, to paint the picture, but I'm not a doctor. And so I knew something was wrong, but everybody was looking at their piece of the puzzle. And that's also a challenge of a fragmented healthcare system, where you've got a primary care doctor who's looking at their piece. I was seeing a pain specialist who's one of the most wonderful human beings in the world and kept me sane through this process. But he was looking at his piece. Then you have a cardiologist, then you have a neurologist, then you have a gastroenterologist. Everyone's looking at their piece, but they can't see each other's data, and no one's seeing the whole picture. And so that was the key problem. That's why it took 8 years to figure out what was going on.
And because you were saying, and then I interrupted you, but you were saying that at a certain moment, the system is giving you probably so much pushback that what did it do to you to be at that place?
It makes you start to question everything. I will admit that I walked out of that appointment with the neurologist saying, no neurologist in the state will see you till get a psychological evaluation. And I just cried. And it's, you know how sick you are. You know how much you want to be a full-fledged functioning human, and you're not. And to hear that is demoralizing. But I'm very stubborn, and I have an amazing husband and an amazing support structure. And so I was upset for about an hour, and then it was like, okay, that's it. What's the plan? What's the plan of action? And in my very stubborn nature, I said, we're going to go see a specialist for every single one of my symptoms. My resting heart rate was through the roof, and I had a very hard time breathing. And so I said, okay, let's go to a cardiologist. That's one thing we can do, right? The heart rate is clear. I'm not making that up. You can see I have incredibly high heart rate, incredibly low blood pressure, and am having a hard time breathing. And so we're in the room with this wonderful cardiologist, and I brought him my gigantic paper chart. And he just kept going, "You're too young, and this is too crazy. It's got to be one thing. It's one thing we're just completely missing." And so he starts going through this giant chart, watching us, and all of a sudden and my husband are like, "You just noticed something. You just saw something." And what he saw was, in me compiling my record and putting everything in chronological order, he noticed my calcium levels had been rising and rising and rising and were now lethal. And it turns out those seizures were from hypercalcification, which was also leading to very, very low sodium. And because I had dysregulation that was impacting my ability to hold sodium, and then I had very high calcium, and he goes, "Okay, I think I know what's wrong. I think you have a disorder, which is very rare for someone your age, called hyperparathyroid disease." And I didn't even know we had parathyroid glands. And we had thyroid glands. Parathyroid are totally different. They regulate two things, and calcium's number one. And if they get basically stuck on, your body is saying, "You don't have enough calcium in your system. I'm going to leach it out of your bones and start hypercalcifying your system."
Your body was eating
Yep.
yourself.
Yep. And so it can literally impact every single organ system. And the reason that my legs were no longer functioning as desired, and the reason why I was lecturing one day and all of a sudden both hands fly up, is because it's like silly putty on your nervous system. And so the signals are just not getting where they need to go, which is one of the reasons I was feeling like I was having a hard time breathing. And so he's like, "Okay, we're going to get you a test for this." They did the nuclear medicine test. If you, in fact, have this issue, the tumor is going to light up like a Christmas tree, and we'll know what's wrong. They immediately got me in for a test. Immediately, tumor lit up like a Christmas tree. I was laughing. I said, I kept telling the neurologist it wasn't in my head. I was right. It was in my neck the whole time. And we were in surgery very, very soon after that, because at that point, then they know I am in a very precarious place, and I'm very lucky to still be here. I was super lucky because I was at the University of Wisconsin-Madison, and the surgeon who did the surgery, usually folks do like one parathyroidectomy a year. This surgeon specialized in it, so it was good because it was sort of tied up in my vocal cords. And he said that he had seen every single one of my symptoms in different patients, but they had never seen them all in one. And they think it's because I got it so young that it was that bad. But I was walking like a duck, but walking 2 days after surgery.
That's amazing. And I always feel guilty for doing it, but bringing it to the topic of interoperability, the word that we weren't going to use often, because it has to do a lot with that whole paper chart, right? Can you explain? Because I think that, but because of your work to put that all together and to look at it, did you make graphs of it? Because you can't like find all these things yourself, right? Or was that all in your record?
So you've got all like the lab results in the record, and it was just trying to put similar types of information in chronological order to make it a little easier to see the story. But I didn't know what I was looking for, right? I'm not a doctor. So putting it in that order, putting it together allowed the physician to be able to see the pattern. That I figured there was patterns here. I didn't know which one I was looking for. But putting the record together that way helped them find the pattern.
And do you say, is this maybe a good definition of interoperability, that all the work that you did to put that together, to get all the data in and put that in a nice order so you can actually do something with the data? That's what we want to achieve
and that's
with interoperability, right?
And that's the goal. And it was that moment that changed the trajectory of my life.
And because the wheelchair could go out again.
I never thought I'd walk again, and we have that. And also, I changed my career path.
Tell us more about that.
I have a master's degree in African studies. I was headed to the United Nations. My goal was international policy. And I pivoted to healthcare policy. And it was, I had accidentally fallen into a job prior to my PhD program with a research firm that does federal contracting work. And I had gone to a temp agency between my master's and my PhD just to find a little work between my degrees. And they said, "What can you do?" I have a master's in African studies. I'm like, "I can't do anything. I don't know, research, I guess." And so they put me in this firm. And they hired me a few months later. And when I went to school, they kept me on to keep working on some projects. But I was working in their education division. And then when all of this happened, I said to the vice president at the time, I said, "We have a healthcare division, don't we?" And they said, "Yes." I said, "I would like to do that." We have some things to fix there. And that was my pivot into healthcare.
Yes. And can you talk a bit more? Because you have quite an influential role. And I think you are one of the foundational persons to a lot that is happening in US healthcare at the moment. So where did that role turn into? What did you start doing? How did you help fixing it?
So the planets aligned for me. And, I had started working in various federal contracts related to healthcare and worked for federal, supporting various federal agencies. And then I decided that if I really wanted to learn more and do more, I needed to move to the federal government. And so I began working at the Centers for Medicare and Medicaid Services. And, through years of having contracted and, meeting people and working in different segments of the government contracting world, I had made friends. And I had started in the Office of Legislation. And very soon after I started, an old friend called my boss and said, "I need Denise's help. We're going to start writing a regulation. And I could use her help working through this regulation." And so I got very lucky to work with Alex Muggy in the Office of the Administrator. And we were working on the interoperability and patient access rule. And that was the first regulation in the U.S. to require FHIR. And the goal of it was patient access to their data. So how do we get patient control their records, understand the data, get the right data, right place, right time? And if there was anything I was passionate about, it was getting the right data at the right place at the right time. So I got very lucky to be able to do the thing that mattered most to me, the thing that got me into healthcare, and to help regulate that and start moving that forward, and then start working on what became the interoperability and prior authorization rule, which has also had a significant impact on my personal life.
Yes, because we could end this talk and think that's a happy end, no wheelchair anymore, and Denise has a perfect job which she likes. But it's not the end, right?
No. So I had always been that sickly kid, right? And so here I am out of the wheelchair, feeling great, doing good. Years pass, and then a new health issue evolves. And even just in the last few years, I had gotten pretty sick again. Couldn't keep food down, dropped to 92 pounds. Not good. Again, know something's really, really wrong. So going from doctor to doctor is everything's gastrointestinal. So going to all kinds of gastro doctors and things, getting everything tested. This time, they were very careful not to tell me I was crazy. They did that once. That was in the record. We're going to do it again.
So they could see that was in the record.
That they can now see in my interval record. But they couldn't figure out what was wrong. And so I just kept going to different doctors and seeing, and I found this wonderful doctor, and she said, "You're clearly very, very sick. I have no idea what's wrong. Looking at your record, I can see you've never seen an immunologist. We have a wonderful immunologist here. How about will you go see him?" So he ran every test under the sun and asked questions no other doctor had. And so that was very exciting. A month later, I go back to find out what he's learned. And he almost comes skipping into the room and he says, "I think I know what's wrong. But if we're going to get one more test, and if I'm right, we're going to have to do this thing called prior authorization." It's like, I don't mind what I do for a living. I know a little bit about that. But what was fascinating to me was he was so clear that as the clinician, he had to be involved in the prior authorization process. What happened in that process was going to be a clinical decision at every step of the way. My care plan was a matter of life or death. And he had to be the one determining how that went. So he was explaining to me that we're going to run this test. If it is what he thinks it is, and it was, which is hereditary angioedema, which is a rare hereditary disorder. I have one of the rarest presentations of it, which is a swelling of the intestines, which keeps things from processing. And so you get very malnourished, and it is a challenge. It impacts only 0.002% of the population, but there's treatment. And the prior authorization was for the very, very, very expensive biologic that is required to treat the disease.
Yeah, because to say this in other words, prior authorization is getting the confirmation and the approval that that treatment can be expensed with your payer and can be applied to you, right?
And to ask an insurance company to pay over $50,000 a month for treatment for the rest of your life is a lot. And so I appreciate that there's going to be this prior authorization process to ensure it is truly clinically necessary and it is the right, option for the issue. So I appreciate the reason they're doing this, but I also appreciate that the doctor was like, this is a clinical decision. I need to be involved. Now, interestingly, at the same time, I do work with the FHIR community, with the standards around prior authorization. And I was working with the Da Vinci community, a wonderful group of payers and providers and EHR vendors working on electronic prior authorization. And we were debating whether or not prior authorization had to be part of the workflow, if the clinician had to be in that process. And there's a whole bunch of folks saying, no, it should be in the back office. It's just an administrative task. Doctors don't care. They don't have time. And I was like, hold on. I can tell you a doctor right now who really cares. And as a patient, I really care. I want to be part of this process. And if we use the standards, if we do this in an interoperable electronic way, I, as the patient, can follow along. My doctor can be involved in the process. And this is a patient-physician relationship. This is a clinical decision. And so to have, again, be in this moment of this real world scenario where I'm also working with the community in the health ecosystem about how do we do this best and right and what needs to happen, and to have those worlds collide yet again in this moment was sort of fascinating. So when the diagnosis came in and it was this, and we had to go through prior authorization, it's one of these moments where you're like, now we finally know what's wrong, what's been causing all these unique issues my whole life. There's a treatment, which is unbelievable for something as rare as it is. But now, will I actually get a prior authorization approval for this? Will I be able to move forward with the best treatment plan per my doctor's recommendations? And that's agonizing for a patient. You're going through so many emotions. Like, am I going to actually be able to get, could this really be true? Could I really be all better? And I got that prior authorization in 1 hour because they were using electronic prior authorization.
And if they wouldn't have, because 1 hour seems 1 hour of stress is long, but it's probably, you make it sound like weeks.
Okay. I mean, weeks is usually what you have to wait. Maybe if you're really lucky and it's something simple, a couple of days, but an hour, that's unbelievable. To have that immediate sense of relief, they're going to be able to move forward. And we did, and we were able to move forward, and it's covered. And I now realize what I thought was my healthy was actually me at 50%. And so I'm the healthiest I've ever been. And yet again, I have the work that we do to thank for helping me get to where I am today. And it's amazing validation, but it also shows the real world need for this. This isn't theoretical. This isn't just an academic exercise. It's not just a regulation. There are patients, and we are really impacted by having the right data in the right place at the right time, allowing our doctors and us to have really informed conversations, to do this together, to do this quickly and meaningfully with technology that we now have safely and securely. It's life-changing. It definitely gets me up in the morning.
Yeah. And I can imagine that there's a lot of patients, a lot of persons who are watching this video and are very grateful for the fact that you got to become a patient and someone with influence on the policies. I'm very happy that you are healthy as you've ever been. I hope we managed to explain interoperability quite well with having your data always available everywhere where it's needed in a secure way. We haven't talked about that. We don't need to go in there, but that's some of the prerequisites of the work that we do. But there's still some time to go, right?
Oh, yeah.
The industry needs to still adopt this more. There is regulation, but we're not in an end state where that data is always there
Yeah.
already. Can you maybe talk a little bit about why it's so important for health systems, for payers to invest in this?
Yeah, payers and providers. I think a lot of times, especially when something is coming through a regulation and you must do this. It's a box we have to check. I'll just do the bare minimum. It's unfunded. What am I going to get in return? A lot. You're going to get a lot. You're going to get a ton of efficiency. And simply by, yes, there is investment that has to happen to start, to set up the technology, to get the data organized in a way that it can leverage the technology. But once you've done that initial investment, then you have these data that your doctors and you as a payer can use to understand so much about your patients, your business, and you can do so incredibly efficiently and effectively, and you can deliver better care. As a doctor, you have so much more information. The doctors I have worked with, having that information is so empowering. It helps them be effective and efficient. It helps them do the job, what they've studied and worked so hard to do it well. But if they can get it easily, it's in their workflow, it's in front of them when they're working with you as a patient, that helps them do their job better and more efficiently. As a patient, I am well more satisfied. And that is something else that impacts how people are paid in our healthcare system. Patient satisfaction matters. And if I'm a healthier patient, I'm going to cost less. And so that's important. It costs less than the $50,000+ a month my medication costs than it would to treat me sick. Hospital stays are a lot more expensive. And so it's important to appreciate that there is the single most important thing, which is it can make patients better effectively and efficiently. But it is also economically valuable and effective to invest in these things, because on the other side, you're going to have so much efficiency. Like even just take electronic prior authorization. And some of the pilots that we've done, some of the tests of the process, we've seen an over 200% return on investment for just starting to use these regulations. Because by simply being able to do a quick check and say, hey, do I need prior auth for this? And it's say no or yes, and this is exactly what you need to do to get it, you save thousands of hours of going through charts and submitting paperwork. And that in and of itself is a phenomenal savings on the side of the industry. So what I think is incredibly important is that we not think of this as just another mandate, just another thing I have to do, just enough to be, not get in trouble for not following the rules, and appreciate that if you go all in, you put the investment up front and the return is priceless.
So we have a return on investment, we have cost savings, we have happier patients, we have healthier patients, we have happier clinicians who are able to do their job better.
Mhm.
Those are just some of the benefits
things.
that you're mentioning. Yes.
Yeah.
Thank you so much for sharing this story. And I think I'm going to say, if maybe you're watching this video because you're that person at a birthday party that asks me or Denise, what do you do for a living? And you are interested in understanding it. I hope this story made that clear. But maybe you're a business leader of a payer or provider system who you know that the tech department is always talking about these things. I hope this version of the story cut through the technical complexity and made you realize what it's actually about. Maybe you were just interested, or maybe you're the tech person that does understand all the complexity, but likes to see why we're doing what we're doing. All of them. I hope you enjoyed this video. And again, thank you very much for sharing that.